Going to start the Facebook Live. So please, guys, if you can see that on Facebook Live, please, guys, let me know. Thank you very much. Let me check if I am there or not. Guys, I'm very happy to see all of you here. I'm very excited. By the way, guys, your result this time was actually very promising result. And I was very happy to see that you really getting better and you progress a lot. Let me check on, where's my phone? Let me share the screen first. By the way, guys, while I'm fixing stuff around me here, there is two important posts I already made on the Facebook. It actually to discuss very important topics on my Facebook, on our Facebook group. So please, guys, ensure that you choose the right topic for the next session. Think properly before you choose. Okay. Just in here. Right then. Okay, guys, I check right now that if I am on the Facebook Live or not. Please, guys, if you can hear me clearly on the Facebook, please let me know. Guys, how was the mock, by the way? How did you find the mock? Oh, that's amazing. I'm very happy to hear this. I always like your feedback. Okay. You know what, guys, I was really very happy to see that we had about 600 candidates this time. And by the way, like 600 and just and then I would say in the beginning of the preparation, not really bad. It means really, you really guys pay attention. And that's exactly what we need. Let me just check here. Ahmed, and then just pause. And Facebook. Go back. Just one here. I see your comments. I'm very happy, Dr. Amolia, to see this, that you did better less than 2 mocks. I'm very happy. Wow, Dr. Muhammad scored 88%. This is really amazing. Dr. Muhammad, that's great job. Okay, today you will know which one. You ask like you want to know which one, right? Today you will know which one you really went wrong. Dr. Bidu, what to study for questions such as question one the mock? No problem. I can tell you, Dr. Melzma. No problem at all. Okay, me just get this one here. To be able to see your comments properly. Okay. Just do it this way. And then need to go to comments. We just, yep, I got this one. Perfect. That's the best ever version I can see. Perfect. Okay, guys, for a start, I would love to check on every one of you. So, hi, Dr. Shashank, how you going? Hi, Dr. Taslim, how you going? Very much, Dr. Taslim. I'm very happy seeing you, Dr. Taslim, all the time. Thank you, Dr. Fatima, Dr. Sangeeta, Dr. Walija, and just get this one here. Dr. Eshika, Dr. Amolia, Dr. Natalie, and then Dr. Anne, Dr. Nikita again, Dr. Slim. Yes, I'm audible. Thanks very much. And Dr. Nitikan, Dr. Walija, and then Dr. Nag, Dr. Shashank, Dr. Fatima, Dr. Mariam, and Walija, and every one of you guys. Simran, everyone. I want to really mention every one of you. Wow. Dr. Taslim got 96%. That is really amazing. I wish guys to get the same in ADC exam. Why, Dr. Nikita? That's okay. If you couldn't do it this time, you can do it next time. Then no problem at all. It was good, Dr. Fatima. I'm very happy. Dr. Muhammad, yes, 88%. Seems like, guys, you've been the highest. And then I'm very happy for you, Dr. Amelia. I will explain this, Dr. Melzma. Dr. Mariam can't see the option. You will see the option right now. Guys, do I have echo? Because Dr. Pracy say I have echo. I don't think so. But if so, please, guys, let me know. Score 72, fantastic, Dr. Afrim, because we needed to score above 60 in that mock. Hi, Dr. Shresa, Dr. Simran, 68, very good. Dr. Leyu with option B always, Dr. Shiva, and every one of you guys. Thank you very much, guys. And yes, Dr. Lev, I love, guys, when you, hi, Dr. Lev, how you going? And I love, guys, when you actually check on everyone. And that is, it means like you really have a big heart, Dr. Lev. Dr. Daniel, good morning, dear doctor. I scored 64. Perfect. Still above 60%. I'm very happy. Dr. Melzma, 75. Wow. Dr. Fatima, exactly 60%, which is still good. Okay, guys. Now, the mock itself. Look, guys, the benefit of this mock, of this mock and these mocks are, the benefits are, one, is actually to test yourself. This is the first benefit. Just to see how you progress. Take it easily. Because we start in the beginning of the preparation. We still have up to, if you look at here right now, we are in 15th October. Means you still have October, and then not September, but November, December, Jan, Feb, and that's enough, because actually March will not count it, because the exam will be about 5 months from now. Okay, you guys have 5 month preparation. Just in the beginning, if you did the exam before, it means the journey will be much easier this time. and then you only maybe missed 10, 20% study, you're going to compensate this time, especially if you couldn't pass any of the clusters. And if for the candidates or the champions, you just started today or this just started about a month ago in the course, in this case as well, you still have 5 months, guys. You know what is 5 months? Believe me, if it's only 4 weeks left, you still can do good for the exam. So don't feel bad at all if you score any low, because the first thing says you test yourself. But most important than you test yourself in this type of mock is actually you check, you progress. You progress. 80%, Dr. V. Well, that's fantastic. It means a progress from the first mock to the second mock to the third mock. And then after this, the third benefit is to get new information. I'm going to discuss new information today. Look at this. The first time you know that option A is correct. Maybe you haven't seen this before. And then, so the first thing is one, you test yourself. Two, to check your progress. Three, is to learn new knowledge, as you see right now. Four, to learn new concepts. These are the benefits of any mock we do. By the way, guys, the mock we do is, I would say, is very similar to ADC questions, right? Very similar to the concepts, because we follow the same Australian guidelines and competences. Okay. Ready, guys? Are you ready? If you're ready, please tell me what is the answer for the first question, please. By the way, guys, I have made a post, and this post is very important, our group, Facebook group. And in this post, I have announced that we're going to discuss very important topics. If you are interested, please, guys, let me know which topic we need to discuss the next. Answer A, alpha, fantastic. I love your comment, Dr. Demple. I will discuss this right now. Okay. Guys, you're right. If you did the answer, if the answer actually was A alpha, you really did great job. How to know information about this? Now, there's a question, how do I know it? You know, when you are actually know the competences in Australia, for example, if you're going to check ADC website, guys, please, guys, listen to this carefully because something very important. It's your map. It's your guidelines. ADC website is something very important. I believe, guys, tell me please, how many of you has checked the ADC website today? Be honest to me, guys, be honest to yourself. Okay, guys? I haven't checked. That's good, Dr. Taslim. I love this, guys, to be honest to ourselves. Dr. Walija, yes, you checked. Very good, Dr. Walija. I checked always ADC website and Connect portal. I'm very happy to let you know. Why I'm saying this? Because when you check ADC website, right? Very good. You actually get more familiar what's happening there. And one of the things is, if you check EDC website, you will find there is a part for Australian competences, which is APRA competences. In APRA competences, one of the topic that you must read for your exam is Indigenous Australian, including kids and adults. Now, what you need to do in this case is you go to check there, and then you found that as a sorry guys, as a part of your topics, exam topics as Australian competencies is Indigenous Australian. Guys, how important is Indigenous Australian? Aboriginal topic. Very important. In this case, what you need to do, we're going to give you this information on the right time about Indigenous Australia, either in form of questions or either in form of video bites, right? Or articles. In the right time, we give you the stuff, or you by yourself know this is something very important. So in this case, go to ADA website and you can be a member there, and then find some articles about them, and there you will find this information. It's a basic information. We know it. Everyone knows this in Australia. It's just the basic. We keep tell our dentist, the junior dentist, and we keep tell the dental assistant, the practice manager, about this information. Why? Because actually we deal with them on daily basis. Okay? So guys, answer is A alpha, 1.5 to 2 times higher in indigenous children compared to non-indigenous children. Why? There are lots of reasons it does make this difference. Lots of reasons. So guys, answer is the best here. So now the question was again, okay guys, what do you think the answer to this question, by the way? We have very easy concepts, right? For this question, not hard at all. Let me check. I'm very happy. Very happy Dr. Wali just said that is very. B, bravo. Where is Dr. Leo? Where is your B, Dr. Leo? Dr. Alifia B, bravo. Dr. Shashank, Dr. Natalie, Dr. Taslim, Dr. Sangeeta, Dr. Amolia. That's why Dr. Amolia is called out. You see Dr. Leo back again with B, bravo. Dr. Luciano B, bravo. Dr. Rana B, bravo. Very good. Dr. Villani B, bravo to Dr. Arshinur. Hi, Dr. Arshinur, how are you going? Dr. Ashwani B, bravo. Very good. Yes. B, bravo, Dr. Fatima. Why's B, bravo the right answer here? The question asks about which of the following investigation, so we're looking for investigation, would you perform to assist in what? Diagnosis. Which diagnosis? Am I a dentist or am I GB? Look, guys, what explained right now is exactly going to be in your exam. Same concepts. You can say concept 1, right? Now, I am a dentist, not a GP. So, like not guys, general medical practitioner, okay? So, diagnosis will be related to dental condition. Diagnosis will be related to dental condition. Now, ask the patient whether he has brought his ventral inhaler to the clinic. If this is going to help me to diagnose a dental condition, no. Because what do you think can be dental condition? The pain is severe and interferes with sleeping. And then lasts for 30 minutes, especially when you drink cold water. Intensifies. So think about it right now. Do I want to diagnose the patient with asthma? Do I want to diagnose the patient with any medical condition or dental condition, So what could be dental condition? Irreversible bulbitis. So now the question here, you really want an investigation to help you, with irreversible bulbitis. So option A will not help me in irreversible bulbitis. Percussion, yes, it can help because we have a condition called irreversible bulbitis with what? Apical periodontitis or periapical periodontitis. And then this is everything? No, because the signs and symptoms may not only refer to reversible bulbitis, but also it can refer to periapical periodontitis, and it can refer to periapical abscess. So which one of these can differentiate between these conditions? Is it OPG? Not good. Why? Because you already had periapical X-ray. Enough. It gives you a good idea. Enough. You don't need to repeat the X-ray again. So OPG is gone. All of the above, no, because A alpha not. A alpha will not diagnose the condition. So now what is the best? B bravo. Why? Because when I tap the tooth, if I tap the tooth this way, and the patient feels tenderness, based on the severity of tenderness, you can say, yes, like if it's negative to percussion, what does it mean? If negative to percussion, let's say negative to percussion, what does it mean? Irreversible bulbitis only. Okay, positive to percussion, it can be two things, either apical periodontitis or apical abscess, right? Now, if it's just only plus 1 plus only or 2 plus max, now we're talking about apical periodontitis. What about 3 plus, 4 plus, 5 plus? We're talking about acute apical abscess. What if the patient tells you he just feels discomfort or something there, like yes or no, like questionable? In this case, it can be chronic apical periodontitis. I hope, guys, I have explained right now how to differentiate between 5 conditions. I hope that you get the difference between all of them so we can use this information next time in any other exam, and especially ADC exams. So the answer here right now will be B bravo, percussion test. Let me check your comments. The first we choose for radiograph by twing if it's about caries. Yes. But if we check the condition of the tooth itself, will be periapical. As in this case, there is ready radiograph. You're very good. Yes, Dr. Socia. No periapical radiolucence in X-ray. Yes, it means there is no infection. Very good. Dr. Shiva says, Dr. Bidu, can you please repeat? Okay, it means I need to go back into the question. Dr. Teresa, acute apical periodontitis have tended to percussion. Yes. First X-rays and sensibility test. Very good. And then percussion. I love this, Dr. Simran. Let me give you a heart, a big heart, Dr. Simran. Periapical X-ray, yes, for caries is by twing. Very good. I love this. Visual radiograph. Very good. You are guys on the right track. Can you please repeat the 5 concepts? Okay, Dr. Okay, Dr. Sosh, I will do this. Back again. Guys, do you want me, guys, to repeat? Anyway, yes, I have Dr. Sosh, Dr. Suyash say yes, repeat, and someone else say repeat. Okay, guys, I will repeat again. Now, Let's do this. One, the question asking about initial diagnosis. Oh, sorry. I need the other one. Yeah, okay. I can discuss it here. So the question here, the same things. So the question asks about initial diagnosis. Which one? So look at the question itself. If you look at the question, you will find that my signs and symptoms, right, will determine my diagnosis. Now, what is the first sign I can see here? One, pain. What sort of pain? And it's mentioned pain related to right first molar. If the patient can tell that the pain coming from that tooth, it means localized or not localized, mean localized. So now, one, it's a localized pain. Two, what sort of pain? Severe pain. As you see right now. And persistent. And the patient couldn't sleep. It means straight away, you exclude straight away. In this case, you exclude reverse bulbitis. Option B is gone. And exclude necropiosis, because necropiosis, it doesn't have that much severe type of pain. And it lasts for 30 minutes. And necropiosis normally not with cold and cold. It can be toward the hot, but not cold. So now necropiosis is gone. Now, which X-ray should I take in this case? I need to show all the teeth, all the tooth, not all the teeth, all the tooth. And then I need to check per apical area. Which X-ray will be the best to do this? Is that per apical or OPG? Definitely per apical X-ray, which is a parallax per apical. We call it parallax per apical. Is more accurate than any other type of X-rays. Why? Because it shows the tooth in good clarity, good size, and give me good information around. OPG will be blurry, will not be clear enough. That's why we like per apical X-ray. What if I was talking about caries? Bite wing will be better if I talk about caries. Now, as I mentioned so far, periapical X-ray. After periapical X-ray, I need to check, is it a reverse bulbitis? It is reversible bulbitis and all this stuff, right? Is it reverse bulbitis with apical periodontitis? Is it acute or chronic as an abscess? So that's why vitality test. Vitality test here, it's given in the scenario. Really? Yes, how? It's mentioned patient, right, feel or the pain intensifies with cold water. What does it mean? If you get cold, patient has severe pain. Now, vitality or sensibility test, which is we like to use the word sensibility than vitality, right, is positive. Now, localized is positive. And then severe pain positive. Vitality positive. X-ray shows the carrier is very close to the pulp. I need now to differentiate between is it chronic reversible bulbitis or acute reversible bulbitis. That was the first question. When you do percussion, now let's discuss about percussion itself right now. Percussion. Percussion is going to give you the periodontium area. What's happening here? Not the crown, because the crown shows, it's showed by X-ray, periapical X-ray. And then inside the pulp, it shows by vitality test or sensibility test. But the periodontium, is it an infection there or the apical periodontitis or what? Percussion. What's happening with percussion? negative percussion. What does it mean? Only irreversible bites. Just positive. Just one positive sign means it can be apical periodontitis. Okay. Positive, like too many of them. That could be two. That's too many. Very tender. Very tender means acute abscess. What if the patient say, I only feel some discomfort, just some discomfort? Like, doctor, this is, guys, the word being used by the patient. Doctor, when I tap here, I feel something there. But does it hurt? No, it doesn't hurt. But it's like heavy tooth. The tooth is heavy. Ah, now it's chronic irreversible bite. Acute reversible, positive percussion, but I don't have this information. Also in the X-ray, I cannot see any widening of the dental membrane. I cannot see any radiolucency. So now we're talking about acute irreversible pulpites. I hope now, guys, is clear to everyone. Next, what do you think, guys, to answer this question? You recommended. You recommended. Recommended what? You recommended perform an emergency access opening as a part of root canal therapy. However, the patient refuses treatment as he is about to drive with his family to Alice Spring. And wow, Alice Springs too far. In 10 minutes, what is the most appropriate next step? Prescribe antibiotics just to follow what the patient wants? Not really. It doesn't help. Why? Because there is no infection, and they cannot prescribe antibiotic if there is no infection there. Prescribe codeine as a patient in severe pain. It can be, but not the first thing. Option A can be right, but not at this stage, not yet. B can be right, but not at this stage. Explain to Mr. Jara the risks and benefits of the medication and the proposed root canal therapy. That is the best. Educate first. Let me check your answer. See, Charlie, perfect. Option explains all. Very good. I love this. Guys, do you want a new concept? A new concept. Words like explain, words like educate, words like discuss. When you discuss something, mostly, not always, but mostly, these are the right words you need to choose in exam, the right options. For example, I see the word explain. Mostly, this is the right answer. Why not prescribe antibiotics? Think clinically. Patients say, you know what, I'm refusing an emergency. I don't do any treatment. I don't do any treatment. And then you explain to them first. Mr. Jara, look at this. Emergency treatment is very important because that is going to relieve the pain. You will be in the best ever after we do the treatment. But you know what? If I prescribe only antibiotics, that's not enough because the problem is the tooth itself. That's the reason of the pain. If you give antibiotics, will not help the situation, especially if you don't have an infection. That's going to be an extra. And why should you buy and pay for it and then prescribe codeine, right? No need to prescribe codeine, and then you explain to them codeine not good, really the best option right now. Once you do the treatment, we're going to remove what? The inflamed nerve inside, and then you will feel better. You're going to sleep tonight. That's called option C, explain. So guys, I'm very happy you got this question correct as well. This is a fifth question. Did I miss any question? No. Mr. Jara expresses financial concerns regarding your treatment plan. What should you do next? Be bravo, Dr. Taslim. Very good. But why, guys? Can we guys start to explain a little bit why? I need to see your justification behind the answer. Dr. Simran, be bravo. Dr. Anon, be bravo. Dr. Eshika, be bravo. Dr. Leo, always be. Dr. Dembo, be bravo. Dr. Sanjita, be bravo. Dr. Natalie, very good, be bravo. Dr. Melzba, correct. Shashank, correct. Very good. Never discount. I love this concept. No discount. In Australia, as a dentist, our profession, guys, it's called profession. It's, you know what? It's not a job. We call it profession. Dentistry, as a dentist, it's a profession, right? So why we are professional? Because we professional most of the time in Australia, we don't like discounts. Could you please answer this one? If we have Dr. Liv ask question, or actually someone ask question, if we have pulpitis, do we start with bite wing and then periapical? No, no. If the main reason, not actually caries, like it's not the main reason today, is that multiple caries all around here and there, in this case, periapical X-ray will be enough because it's just if the patient complain only one tooth, if the patient complain as I have pain from this tooth only, in this case we need to focus on that tooth. But if you look at the patient's teeth and then it's a checkup and clean and they found the patients really have lots of cavities, in this case bite wing, not every time bite wing and then periapical X-ray, depends on the situation. Okay, back again to this question. Guys, by the way, I love your questions because really very smart question. Yes, you're right. Do really I need to take a bite wing X-ray first for any caries and then periapical X-ray? No. We take a series of bite wings when we believe this patient is high risk of dental caries. He has multiple cavities, not only one. But if it's just only one cavity, I may start with periapical X-ray and see. If I am doubt that the patient has multiple caries, in this case, maybe we can take bite wing after this. But we need to focus on the patient's concern first. Now, over 50%, not professional. Offer payment plan. Perfect. We love it. Why payment plan is a good option rather than C? Why? Because look at this keyword. It's very hidden keyword. Look at this, the hidden keyword. Guys, can you catch the hidden keyword? This is the hidden keyword. Financial concerns. Because if I change financial concerns means he maybe struggle with payment this time, but he has money. He may not be able to pay all in one go. He may be scared. He may be thinking that he need to pay 15,000, 1,500, no guys, 15,000, 1,500, 1,500 Australian dollars upfront before he start the treatment. He has concerns in his head. In this way, because it's an emergency case, patient in pain, so you need to do some treatment for him. And then tell him, that's okay. We can put you on payment plan. You don't need to pay everything in all together. We can make you to pay $20 every week. How does it sound to you? Is it good to pay us $20 every week? No, doctor, can you make it $10? That's okay, $10 every week. So now for the treatment, how long it take? Maybe a year, maybe more, because how many weeks, guys, we have? 5 too? Yes, it means like in 1 year, you're going to get 5, maybe 3 years. Yeah, why not? Help them. In 3 years, you're going to get your money anyway. Right? In 3 years, you're going to pay $10. You're going to be, right, $20 per week. Help the people, right? Once you help them, and then you're going to get your money back after a year or so, why not? Right? What about refer him to public dental hospital? Valid option, correct, valid. But is it the first one? No, not the first. the first option. When actually we need to refer the patient to public dental hospital. One, if he prefers this. If he knows and prefers. By the way, this option should be discussed with the patient as well before anything. You must explain to the patient before anything that he has the right? He has the right to get free treatment in public hospital. In Australia, guys, we provide free treatment in public hospital for operational people. Right? Okay. Two, when the patient doesn't have money at all to pay, he says, I don't have money at all to pay, not even one penny. I will not pay you. That's okay. Option C now it's good. But so far, the patient just only has some financial concerns. That's why B Bravo is good. Offer free extraction. That's a very aggressive type of treatment. B Delta, very aggressive. Very aggressive. Are you going to extract the tooth because the patient cannot pay? It's better to refer him to public hospital rather than to extract his tooth. Next scenario. Guys, what do you think the answer for this scenario? Which examination investigation would you do first? By the way, if I believe you have read this question, right? And then because you read this question, you know it's an avulsion case. Yes, to refer him, yes, after you address the emergency, yes. Once you address the emergency, yes. Then we can go to jail for free. Yes, Dr. Luchan, I'm very happy. That's a good concept. I'm very happy. If he prefer or cannot afford both Dr. Daniel, yes. Let's say he say, I don't have money at all. I will not pay you anything. That's okay. Now you can go to hospital then. You may even start, but at least you need to discuss with him. You cannot say, you cannot just only see him from on the door. And then, for example, what if you have a patient and the patient has irreversible pulpitis and is very severe pain and he is on the door of your clinic and he says, I cannot afford the treatment. Can you dismiss this patient from clinic completely? Say sorry, because you cannot pay for the treatment, you are not allowed to see the dentist. That is bad. Even if he cannot pay for the treatment, as a sort of ethics and professionalism, in this case, right? As sort of ethics and professionalism, in this case, what we do is at least the dentist should see him and talk to him and explain the situation. At least. And give him different options. The dentist must give him some options because patient in pain. Okay. Option C, radiographs, very good. C, C, C. If patient is in pain and he says, I don't have money at all, what we do? Okay, Dr. Ashint, I already explained this question right now. That was a very good question. Option C, 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 Dr. Alifia, Dr. Amolia, Dr. Gillian B. Why Dr. Gillian B? Why percussion? The tooth already, the tooth already avulsed. It's knocked out, not in the jaw. What you going to do percussion exactly? If it's luxation, I can say B, but it's not luxation injury. It's avulsion injury. In luxation, percussion can be okay, gently. Arsenal, I would go with C to analyze the socket. Yes, I agree in this. To look at the fracture, what's happening there? See, Dr. Fatima, Shivali, everyone, see. To check an alpha fracture. Yes, I agree in this, Dr. Sanjita. Root fracture, I agree. Fragments, I agree. Yes, see what's happening. Do emergency as in hospital and sent to hospital. Yes. Or at least talk to the patient. At least talk to the patient, at least. Yes. Dr. Bido, what if he cannot pay but needs emergency treatment and we do emergency procedure? Do we charge him? He should agree on it in the beginning. Yes, it's your right to charge him. But the best way is you can actually refer him to public hospital in this case. But talk to him first. Explain to him, give him away, give him the, because if you dismiss him from the door because he does not have money, that will be very bad. But at least even if you're not going to do any emergency treatment for him now, at least to give him an option. But what if he insists? Look at this concept. What if he insists? I would say, honestly, as a professionalism, do it for free, honestly. If he says, if he find any reason, like there is no any hospital around right me now, for example, I'm just saying an example, and you are the only one in the area, like regional area, and no any close by dentist, and no one except you, do emergency, right treatment for him for even for free, and then you can talk to the Medicare, you can talk to you can talk to Medicare, right? And then you may even get back again this money. I believe even the government will pay for you. Very nice question here. So if patient has no money at all, we refer to public hospital. Yes, Dr. Jillian. Yes. Or if there is no public hospital around, or it's too far, or no any other dentist, or there is no any possibility that he got, because guys, by the way, there are some clinics as well made only for Aboriginal people, by the way. There are some clinics, right? They already made for Aboriginal people. Okay. So if there is no clinics around you for free and there is no public hospital for free, you are the only around in the area. In this case, we may recommend that you do the treatment and then you can claim it from Medicare, for example. Or you can talk to the hospital about it, or you can claim from him later on. But don't leave the patient in pain because he has no money. Anyway, back again, guys. Answer is percussion. What percussion? Sorry. What's this? White rock? Radiograph, okay, guys? I don't know what's this. Okay, guys, radiograph, no B bravo. Percussion is not good because that in luxation, maybe percussion can be good, but not this one. Which factor is the most significant in determining the prognosis of free implantation? A, B, C, or D? Which one? A, B, C, or D? A, vitality of pulp cells. Tooth with closed apex, delay in treatment. You know what? Delay in treatment. Not A. C. Not A, Dr. Shiva. You're right, Dr. Gilan. It's C. A. Viability of pulp cells. No, because the pulp anyway gonna go. The pulp, it will be dead anyway. The pulp guys will be dead. Because you need to do root canal treatment. That's wrong. It should be, please read properly. Please read the options properly. Why? Because it can be viability of what? Periodontal. Not palpal. You see? I changed the word palpal. I replaced periodontal with palpal. Now it became tricky. If you don't read properly, you can choose A. It's not A. Because it's palpal is wrong. Palpal is wrong. This is made it wrong. Tooth with closed apex. Honestly, it doesn't make that much difference. A little bit difference. Closed and open apex, a little bit difference. Even some people say open apex is still okay. But the things really does make difference mostly is delay. Okay, guys, in order, right? One, the viability cells, the viability of periodontal cells. What does affect the viability to make the periodontal cells viable or not? Time, delay in treatment, time. What after time? Guys, these are the most important factors for your treatment success, for prognosis. Please, guys, write down this stuff, okay? Maybe I can make it easy for you. In order, which factors, which factor does affect the prognosis, which means success of the treatment? One is viability of periodontal cells. Okay, now viable dental cells affected by what? Affected by time, delay. The more you're going to be delayed, the less is the success. Two, can you guys help me in this? Sorry, three, media. Which media, which liquid? Is it milk? Or is it water? Or is it saliva? Milk is the best. Before we used to say Hank solution, but not valid, not available everywhere, Hank solution. Three, how did you deal with the tooth? How do you handle the tooth? Did you handle it with wash it with water? Because we don't like to wash it with water because you're gonna kill the cells. Five, you may think about close the apex. You may think about open apex, but after what? After this. Okay? The dirt and clean and stuff later on. And then treatment with fluoride, treatment with hydrogen with sodium hypochlorite, these other things. When did you do when will you do the root canal treatment? If there is fracture or not on the bone. All these are the factors that determine your success. Patient medical condition. Patient is immunocompromised, you must give them prophylactic antibiotic. And all this stuff. I hope guys you wrote down all this information because it's really very important. Next. How would you re-implant the tooth back into the socket? Considering the elapsed time, how long? 5 hours. What does it mean 5 hours? More than 60 minutes. Now we have, do you think guys we have a separate, completely special protocol or not for less than 60 minutes and more than 60 minutes? Yes. If it is less than 60 minutes, what does it mean? You just only handle the tooth and splint it. Clean it and then splint it. That's it. Remove the dirt and then splint it. But what if it's more than 60 minutes? In this case, you need to do which option, guys? Option D. Very good. Right, Dr. Gillian, option, Dr. Rana, option D, Dr. Chan, option D, Dr. Amalia, option B. No, Dr. Amalia. It's D, please. Dr. Shashank, option D, Dr. Leo D, Dr. Melzma. Please D delta, Dr. Melzma, not B. Dr. Taslim, very good. D delta. Dr. Very good. More than 60 minutes, D delta. Very good. Yes. Guys, again, the answer is D delta. Guys, what is the reference about this, guys? Which reference we use for this question? Dr. Anderson book, and trauma guidelines, International Dental Trauma Guidelines, IDT, right? Guidelines. Soak the tooth in saline for 5 minutes. Not neat. Wrong. Rinse with sodium hypochlorite. Odil, we discussed this last time. Dr. Odil book mentioned you soak in sodium hypochlorite for 5 minutes, but not to rinse it. Wrong. And then, yes. So soak tooth in saline. Why do you want to soak it for saline? No need. Soak the tooth in sodium fluoride for 5 minutes. Sodium fluoride, no, it should be 20 minutes. You soak in 20 minutes in sodium fluoride. Wrong. Soak the tooth in calcium and sodium fluoride 5 minutes. Wrong. We said 20 minutes. But option T, 20 minutes. Correct. Rinse with saline. Perfect. Reimplant with gentle percussion. Perfect. Perform RCT within 7 days. Perfect, perfect, perfect. So the best here right now, D delta. From where the reference? Dr. Anderson, and then the International Trauma Guidelines. And by the way, guys, these are the two references from ADC. That's why I said it's very good to check ADC website. It's always very good idea to check ADC website. Question 4. Easy question, right? If the tooth is avulsed, as you see right now, which is completely knocked out, do you want to splint it? Yes. Again, apply the same concept. Always, guys, we use gentle. Guys, please, guys, be careful from this. Always use gentle splint. Except if there is bone fracture. In this case, you may need to use semi-flexible. Before we used to rigid, but I think we stopped the rigid. I don't know if already anyone still use rigid or not. Maybe some guidelines mention rigid, but yeah, I think so. Like you can use semi-flexible or rigid, but I believe we go more with semi-flexible. Why? What is the benefit, guys, to use flexible splint rather than the rigid splint? Can someone please, guys, tell me? This is Dr. Arshnu. Yes. Guys, why, guys, we like flexible splint rather than the rigid splint? What's the difference between both? I make it easy for you. Let's say, let me just do something here first. I will show you something. Okay. Let's say that you have this type of splint. One is flexible, the other one, which is rigid. You know what's gonna happen? If you use flexible, every time the patient bites on the tooth, will allow the tooth to move gently and nicely. And that's what we call it as the physiologic tooth movement. What is the benefit of physiologic tooth movement? When the tooth keep moving nicely, it will, very good, Dr. Lev, I can see this. It will prevent ankylosis. But what if you're going to use a rigid? The tooth, as you see right now, will not move anywhere. And that's why the trauma will be transmitted from the tooth to the periapical area, and this will result in ankylosis. That's why we like flexible splint rather than rigid splint. How long? 2 weeks is a gold standard. But if the tooth has a delayed more than 60 minutes, which is 5 hours in this case, it means you may need to leave it up to 4 weeks. Again, from where did you get this information? You will find it from Dr. Anderson's book. See, Charlie. What do you think, guys, the answer for question 5? After splinting the avulsed tooth, what should you do next? Are you going? Think about it clinically. You already splinted. After you splinted, are you going to do sensibility test? No. We actually do sensibility test before, right, the splint. But do we really need to do vitality test in this case? No. Why? Because anyway, you're gonna kill the guy. You're gonna kill the tooth. You're gonna do root canal treatment. You're not going even to keep the tooth alive. Be wrong. Incisor grinding. Bye-bye. No license for you anymore. We guys don't do incisor grinding. We don't like to do this grinding. We don't like to grind the tooth unless really. That's the last option. Then B and C. No, we said incisor. So the only thing left for us is antibiotics. Now, guys, which antibiotics we actually going to prescribe here? Tell me, please, based on the old TG and new TG, the old guidelines and new guidelines. By the way, guys, TG is just the guidelines, which is updated in Australia. Which type of antibiotics we going to prescribe in this case? Tell me, please, the new TG or new guidelines is this? The old guidelines is this. The old guidelines is doxycycline. The new guidelines is amoxicillin. Guys, am I guys clear about this? Very good. The old TG, that's why I'm saying keep, look guys, old TG is valid so far. Old TG is a book valid so far until we hear from ADC. But I have some fear and some concerns inside me that they may say follow new TG in Feb and they were gonna stuck badly. So let's be ready, and we should know the two informations, the old and new, just in case if they say now we need to follow the new TG before your exam, at least we know it. So old TG is doxycycline, but the new TG is amoxicillin. Yes, Dr. Luciano. It can be in December, Dr. Luciano. Yeah. Who knows? So let's be ready. Okay. Dr. Daniel asked a very good question. Doctor, how long do we keep the semi-flexible splint for bone fracture? I would say minimum 4 weeks. Minimum. Sometimes it can extend to 3 months. Okay, perfect. I'm very happy, guys, with this stuff. Look, Dr. Oker, yes, if this is actually being given with the same reference that's ADC follows, which is Dr. Anderson, yes, we do this. Yeah, because Dr. Zina, you're right. Even trauma guidelines go with amoxicillin, right? Because in America, actually, we use amoxicillin, not doxycycline, and trauma guidelines America. But in Australia, we used to follow with doxycycline because Australia different than America. But now Australia followed what's in America, so we need to follow now the American F new TG and Big Sam. Yes, Dr. Melsma, even can be 4 months. Yes, it can be very long. Yes, it can be long time. No necessity, Dr. Gilan, all the time. Just put it on normal occlusion. Okay. Question one. The mother says that's just a new scenario. The mother says that her son may need sedation. What is the most appropriate management? Let's see what is wrong with this patient. A 4-year-old boy. You see, when I see now a question that's I need to read the scenario, now I go back and read the scenario. A 4-year-old boy accompanied by his mother visits your dental clinic. The mother expressed concern about the appearance of her son. Okay. Okay, has asthma and eczema. Okay, nasal congestion. Okay, be careful. We have nasal congestion. The mother reports that he brushes. Okay, that's right. The mother says he needs sedation. What's the word? Okay, prescribe oral sedation. No, we not allowed. Right, guys, especially in all TG, we not allowed to prescribe oral sedation to kids. Who's guys allowed to prescribe oral sedation? Those guys allowed specialist, no Dr. Shashank. You see, Dr. Shashank, I know, you see, that is one of the things you didn't get it right, okay? I know most of your questions were correct. This one's not. Because we are not allowed to prescribe oral sedation. Yes, even if there is nasal congestion, you should talk to specialist. Yes, I agree. Nasal congestion, not good. Totally agree. Right? But still, you need, okay, yes, you still need to discuss to the specialist, with a specialist. So let's agree on this one. Now, nitroxide sedation is out of general dense scope. No, nitroxide is not out of our general scope. Eczema can aggravate. I don't think so. Administer nitroxide. Look, you know what, guys? Tell you something. Make you happy? Make everyone of you happy, guys? Guys, you want to be happy, guys? Yes? Okay. Discard this question. Discard it. You know what? There is no right option here. Discard this question, please, guys. Okay? So if you scored 60% and now you scored 65%, add 5% for yourself, guys. Okay? Yeah, there is no right option here. Yes, yes, yes. Because, yes, you're right. If the patient has nasal congestion, how come I administer not oxide? That is contraindicated. No. Option A is not right because option A is not right because you need to discuss with the specialist. However, option A can be correct, but I still need option A can be correct, but I still need to discuss with specialist. B, Bravo, completely wrong. 100% wrong. Eczema, 100% wrong. Admesus nitroxide, wrong. Because patient has nasal congestion. This one is wrong. Otherwise, how come the gas will go through his lung, right? No, 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 it's wrong. Option A, the only one can make sense, but still, I need a specialist for it. Guys, score 5% more right now. I know everyone is happy, right? So if you scored 65%, you are now 72%. Because there are 25 questions, every question about maybe 4 to 5%. Okay, next question, please, guys. Everyone is happy, huh? No, no, Dr. Daniel, I don't think so. Not excited, no. Eczema, no. Yes, congestion blockage is the same, yes. Because when congested means it's blocked, yes, yes. Now, a 4-year-old boy, the same one, the same guy, given that with nasal congestion, given that the patient is high risk, which toothpaste would you recommend? It has high risk, right? D delta is the right answer. D delta. Easy one. You find in TG. Search forward. 1000 ppm fluoridated toothpaste twice daily. No problem at all. Check answer D, 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 D. Very good. Twice a day, yes. Otherwise, let's say, guys, let's make the situation as hard. What if this child doesn't like the adult toothpaste, which is 1000 ppm, and he only likes the 400 to 500 ppm only? What do you need to do in this case? Thank you very much, Dr. Sangeeta. Yes, more frequent use. More frequent use of 500. Very good. Thank you, Dr. Arshino. Frequent use of current toothpaste. How much toothpaste is being, but it doesn't say how much toothpaste is using. We don't know which toothpaste is using right now, right? Because it does say that the current toothpaste it doesn't contain fluoride. So option B is wrong. Option B is wrong straight away. Please, guys, read carefully. Frequent use of the current toothpaste. Current toothpaste, no. So in this case, what we need to do is either 1000 ppm fluoride toothpaste twice daily, or frequent use of, not the current. It should be 400 to 500 ppm. That's going to be the best option, okay? Please, Dr. Arshino, read this option properly, okay? Yeah. In order. Now, the patient weight is 25 kilogram. You need to administer lignocaine. How many cartridge, guys? How many couples? By the way, the calculation is in TG as well. A alpha, very good, Dr. Taslim, Dr. Luciano. B bravo, Dr. Alifea. Let me check why can be confusing then. No, 4 cartridge is going to be too much. 3 cartridge. Guys, I think calculation TG, am I right? 2.2 by 20. How much? Let's calculate it that way. 2.2 ml, because the carbol looks like this. This is, guys, not cigarette, okay? That's a carbol. And the carbol is 2.2 ml. And lignocaine is 20 inside, 20 milligram inside it. So the total lignocaine inside 2.2, so multiply 2.2 by 20 gram, 20 milligram. How much, you guys? 4.4? 44. So every carbol has 44 milligram of lignocaine, right? The child, okay, now, the child weight is 25. The maximum lignocaine can goes in his body is 5 milligram. So please, guys, can tell me how much? 25 by 7? Okay, 7 by 5, 274, 70, 175. Yep, 175 milligram. So this patient can carry in his body 175 milligram of lignocaine. And every cartridge has in it 45, 44. So now can you divide 175 by 44? How much, guys? 3.9. Perfect. 3.9. Guys, easy now, guys? 3.9. Do you think which one gonna be safer? 3.9, which is 3 carpools or 4 carpools safer. Are you going to give him extra 0.1 if the maximum is 3.9, or to give him only 3 carpools? 4 or 3 right now? Three. Thank you very much. I hope everyone. 44. How did you get this? Okay, Dr. Daniel. I will calculate again. Let me just do something here first, and then I will calculate again. Dr. Daniel, can you please say hi to me, Dr. Daniel? Clear, 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 clear. Clear all drawings. Please say hi to me, Dr. Daniel, okay? Let me go back here again first. And then come in this part here. Repeat. Okay, Dr. Jaylan, I'll repeat. Okay. Okay, Dr. Daniel, now I explain to you, okay, one by one. This is the cartridge. Let me draw for you. Okay, you know what? Give me a second, please. I'll show you something easy. Easy, easy. Okay. In Australia, we use 2.2 cartridge, not 1.8, because I understand in some countries, especially US, we actually use they actually use a cartridge which is, I would say, look at this, please. I see, guys, this cartridge. Choose any of this cartridge. Let's say the first one. How big is this cartridge? It is 2.2. The cartridge from here to there the cartilage from here all the way to there is 2.2 milliliter. 2.2 milliliter. How much concentration of lignocaine inside? It is 20 milligram in each part of this, like 20 milligram in each milli. Like, you know what? You have 1 mil here, 1 mil, 1 mil, like 1 mil, like, sorry, 20 milligram, 1 mil, like until here. Look, let me divide it nicely. Yes. So this is 1 mil. You have 20 milligram. And there's another 1 mil. You have 20 milligram. This is 0.2. It means not even 20. That is less. It's gonna be like something small, like 0.2. Yes. So now in all this 1 mil, 20 mil. 20. So it's all 20. So in this case, multiply 2.2 mil, the whole size, by the concentration of the lignocaine, which is 20 milligram, equal to 444. Okay? Yeah, 2.20 a gun, so it makes 2, multiplied by 2, so it's 2, multiplied by 2 equal to 44. Easy now, Dr. Daniel? Easy now, how we get the 44? So H-carbol has 44 lignocaine. Why? Because it's 2.2. And the concentration for HML is 20. So guys, now the answer, guys, is, I hope now it's clear to everyone. 3, because the maximum dose is 3.9. So 3, it's much safer than 4. Next question, please, guys. Wow, that is overthinking, but I still love this question. But doctor, why you didn't include adrenaline concentration in the calculation? Because it's already involved in it, which it does make just a little bit of decimal there. Not big. It's not big things. It's just a little bit decimal. Because it is 1 on 100,000, something. Just a small decimal, which is a micron. Micron is small like this. No problem, Dr. Daniel. Okay? That's overthought, but still I like the question. Dr. Alifea. Because adrenaline is 27 micron. You know how big 27 micron is? Nothing. Very tiny, small. It doesn't affect the calculation. The question here about which of the following statement about nitrous oxide sedation, and the answer is true. C is the best. Repeated nitrous oxide exposure may be associated with a spontaneous first trimester missing. Guys, do you agree on this? Yes, I agree in C, Charlie. Okay, easy one, straightforward one. You notice white lesion on some teeth in the cervical region when a plantar probe is run over them. No cavitation is detected. What would be the most appropriate next step? Easy. That should be easy concept here. What do you think is the right answer? You really, once you open the patient mouth, you found lots of cavitation, you found white lesion. You don't know, is it really white lesion, is really cavitated, not cavitated? How to determine if they are ICDs now? We'll talk about ICDs. How to determine that, right? That this is ICDs code 0, code 1, code 2, code 3, code 4. And by the way, option A is diagnostic option, by the way. A alpha, perfect. Why A alpha? Because you need to diagnose the condition. Diagnostic option. Again, a new concept today. Diagnostic option is preferred than the treatment options. Option B, advice professional application. That's a treatment option. Seal, treatment option. Use microabrasion, treatment option. But diagnostic option is much better than treatment options. A 7-year-old patient visits are, guys, very tricky. I think if you have lost some mark in this exam, right? I believe if you have lost some marks in this exam, I believe this is because of these two scenarios, either this or the next scenario. Now, a 70-year-old patient visits your dental clinic located on the second floor after climbing several stairs. While waiting in the reception area, he appears apprehensive. That's a key word here. Look at this. The key word so far is apprehensive and agitated. Suddenly he collapsed. Where about did he collapse? While he's in waiting reception area. Okay. The dental nurse reports that the patient has normal breathing and pulse. Normal breathing and pulse, it's not a heart issue. Normally with heart issue, find the pulse goes all the way down. He's placed a reclined position and the consciousness is soon regained. It's not heart disease. Because cardiac arrest, he will not regain the consciousness in few seconds, in few minutes. Never happen. Stroke, it doesn't have the same signs symptoms. A stroke is not like this. Stroke, like the patient will have more other things, like maybe breathing issues. A stroke may have, will not be able to move some part of his body. He may lose consciousness, which he cannot regain just if you reclined him. Cardiogenic shock is the same like cardiac arrest. So now the best way is A alpha. You and your dental assistant manage the patient, monitor his condition, and make him comfortable. You placed him on the dental chair. Soon, he begins to have difficulty breathing. Uh-oh. Another issue now. While lying down and is unable to speak because you put him down. That's wrong. Patient with asthma, you cannot put him down unless there is a condition, as we said right now, which is loss of consciousness. Normally, we don't like to put him in lying position unless there is a reason behind it. What should you do next? It's an asthma attack. A or B or C or D, which one? It may check your answer. B, I love it. Why B? Because puffs should be given through spacer. What if you don't give the puffs? Okay, guys, what sort of medicine the patient is taken to treat asthma? It could be salbutamol. It could be corticosteroids. Corticosteroid can be for treatment. Salbutamol will be preventive. Both of them, they can easily dry the mouth and they result in caries because they are acidic if they touch the teeth. That's why we like the spacer to prevent this medicine to touch the teeth. So be brave. Why NSAIDs avoided, and NSAID guys, which is painkillers, which is in like ibuprofen, okay, and aspirin, it's NSAIDs, non-steroidal anti-inflammatory drugs. Why non-steroidal anti-inflammatory drugs avoided in this patient? Because the patient is what? Has bronchial asthma, asthmatic, and also has heart disease. What's wrong with the lung and heart diseases? Both of them are going to act on kidneys and reduce the GFR. What's wrong in this? This actually may increase the patient blood pressure and may result in heart failure if the patient has a heart failure or heart diseases. So answer is C, Charlie. It will slow down the digestion of the painkiller. The patient reports diet. You see, guys, there is very hidden keywords here. I know some of you answer this question as D delta, which not really right. Why? Because look at this, the keyword I mentioned it to you. Patient reports a diet consisting of cheese. If patient eats cheese, do you think the patient has allergies to milk or dairy? If the patient eating cheese, not like consistent cheese in his diet, do you think this patient has allergies to dairy like milk? No. So that's why CPP ACB can be given. I have no problem to be given. But the question say avoid. So CPP ACB shouldn't be avoided. Fluoride gel. No, fluoride gel has no anything. It's good. Fluoride toothpaste, no problem. But the problem is varnish. Why varnish? Because the patient has severe bronchial asthma. If the patient has severe bronchial asthma, what's gonna happen? Varnish has latex in it, right? Or some components that's actually going to irritate the lung in case of severe bronchial asthma. That's why fluoride varnish is contraindicated for patients they have severe bronchial asthma. Not every asthma, but severe bronchial asthma, severe cases. Question 5. What would you advise a patient regarding his condition? What do you think is the right answer? A or B or C or D? You remember we said before, if the word educate is there, will be the right answer, yes. So definitely educate him about his condition, proper oral hygiene and necessary lifestyle to change all the things around and to enhance his life. So option C, educate him. What is the most likely reason for Mr. Thompson root sensitivity? They mentioned that there is root sensitivity. There's you found what did you find? Australian man presents dental practice complain of dental hypersensitivity, particularly in his anterior teeth. aggravated by hot, cold, and sweet foods. He mild periodontitis, cracked tooth, and the cracked tooth require root canal treatment following recent trauma. Jack, whatever, ginger recession, whatever. Okay. What is the most likely reason for Mr. Thompson root hypersensitivity? The answer is B, bravo. Have, we must, yes, Dr. Gillian, you're right. We must have an open dental tubules to P sensitivity. Why? Gingival recession only, yes, Dr. Lev, you're right. But that's good. You got the right, that's very good then, right? You got the right information now. Why? Because easily you can get gingival recession without sensitivity. But after you get gingival recession, okay, Dr. Nikita, can you say hi to me? Because that's not good question. Why not A? Dr. Nikita, can you please say hi to me? Dr. Fatima, Dr. Daniel, no. You see, guys, I love when you get the right answer, okay? Yes, Dr. Nikita. Answer, guys, not A alpha. Let's discuss this question together. Now, let's say, Dr. Nikita, you have a patient with periodontitis. And the patient has sensitivity because of periodontitis and open dental tubules. Let's keep it this way. Then, okay, let's say this one. Give me a second. I will explain even in very easy way right now to understand it. Let's make it very easy. Generalization. Give me 1 second. I'm just guys doing something to make it easy for you. Okay. Guys, can you see this photo right now? Guys, can you see this photo? Especially Dr. Nikita. Dr. Daniel say, I love the idea that we can have gingivitis, recession, and the noise sensitivity because I met a lot of cases. Wow. But yes, open stage abuse is problem causing. I'm very happy, Dr. Daniel. You see, when you apply clinical dentistry, you see, I love this. When you guys practice, I love this, Dr. Daniel. Thank you very much. Let me give you a big heart. Yes, and I explain this because people think gingival recession is enough to get to get sensitivity from books because books mention, and that's right. You need to get gingival recession to get open dental tubules, mostly, but not always. But to get sensitivity, you must have dental tubules. So, Dr. Lev, right now, look at this. There is a gingival recession here. Let me do it for you. But just a tiny gingival recession, but still existing, because we want the gum to be under this level somehow. So now the difference from this gum level and this gum giving me at least 1 to 2 millimeter gingival recession, which is this part. What has happened? The exposed dentin, as you see right now, this photo. As long as the dentin is exposed and the entire tubule is open, now you can feel sensitivity. You know what? Tell you something right now. You treat this condition manually. How? Just do a little bit of scaling here. Get a scaler or curette if you go subgingivally. Curette and clean this area. Clean it, clean it, clean it. And then give the patient desensitizing agent like fluoride. And then put it here to block all of this. And then do nothing. Do nothing after this. You only did conventional scale and clean. Only conventional, not surgical. Do you think in this case that the gums will grow up again if you only do conventional treatment with a scale and clean? Do you think by your treatment, by peri treatment, which is valid, you can do this, right? It's valid. I can only do scale and clean only to remove all the calculus and soft dentin, and then apply desensitizing agent to block all this dentin tubule, or sometimes even a very thin layer of GIC, calcium, glycerol cement to block the tubules. Now, do you think if I do conventional scale and clean, the gum will go back again? Let me see the answer. No. The gum will not go, right? No. Long, yes. What can happen is, but it will not go back again. No, the gums, guys, with conventional will not go back again. The gum with conventional will not going to be back again. Right, guys? Dr. Liv, you asked this question, right? But the recession, but the reason for opening the time to abuse is recession. Not really, not necessary, but it's a big one because sometimes you may have, look at this, sometimes you have pseudo pockets with gingival enlargement and the food will stuck down there, right? And then you may get opened entire tubules. Not necessary all the time. You may get distraction because you may get distraction in the periodontium, but the gum is inflamed and it's swollen. It will not recede down, but it will go up as pseudo pocket, which is not recession yet, and you still have open entire tubules. And not every time that you're gonna get recession, not every time you're gonna get recession and the bone and the root is exposed, you're going to get opened entire tubules. Yes, because cementum is lost or cementum is permeable, like it is diseased. Okay, yes. That's why we need fluoride. So now, guys, I'm going to go this point again. Now, look at this point. What has happened is gingival recession. In the first month, what I did is scale and clean. Nicely, no more any open cementum, no any more defective cementum, no any more defective dentin. And then we actually use desensitizing agent like fluoride. And then you block all the things. The gum already still receding. And then the pocket has been reduced. Even the gum recession became more. Look at this. I will make you surprised. Sometimes after we do the treatment, the gum recession even will be less. Like will be even going down, an exposed bone. Do you think this patient will have sensitivity after finishing the treatment? No, will not have sensitivity. Why? Because we treated the open dental tubule. But did you treat the gum recession? No. Okay. Guys, who's guys periodontist here? Do you have guys any periodontist? Is it really necessary every time when you actually going to treat periodontitis to do surgical treatment for periodontitis to ensure that you have proper position of the gum back again to treat the recession? No. we can end up the cases of periodontal diseases with recession, especially lower teeth, especially back molars, not a static area. We keep the recession. We don't treat it if it's tiny recession. So this patient, after you treat them, do you think they will have sensitivity? No. All the people, they have physiologic tooth movement. Like this guy, let's say a guy with all teeth. Look, here, I will do something for you as well. Let's say 7-year-old guy, old, patient, with gum recession. Okay. Do you think that all the people like this person must have, like this guy, do you think this guy must have sensitivity? He's old. Do you think, guys, how many or a percentage out of 100%, how many of all the people they have gum recession? 90% of all the people they have gum recession. Do you think 90% they have sensitivity? No. Some of them they have sensitivity, some no. So now, guys, again, it is open-ended title pupils. Be brave. Next question, question 2. The answer is, I hope it's clear right now. Yes, Dr. Gilan, maybe, but not every single one, Dr. Gilan. Maybe in this photo it was, but not every single old person should have it. By the way, sometimes even if you have defective cementum with all the people, there is a reparative dentin. There's one extra tertiary layer of dentin can be added up on the top of the normal dentin to compensate the defect in cementum. So not every old person, if it was defect in cementum, can. Okay, I don't, Dr. Lev, I don't understand the thing which is showing on picture is recession. Not okay. I'm only talking about recession only. Forget about the defect. It just was from Google. Okay. No abrasion, but in all cases, I in the title views, but in all the cases, yes. So I think it was a little bit of caries, only caries, soft, only caries, only. Yeah. The photo was in the X-ray. I think it's just a little bit of caries. That's a little bit of caries because if I find all the and this is most probably arrested caries. That's arrested because it's a little bit dark. And above the gum lines could be arrested. Okay, but that's caries anyway. That's caries. Okay. But I was talking generally, not all the older people, they have sensitivity, but most of all the people, they have gum recession. B bravo, softer press. Yes, softer. Yes, it's very good. We guys like softer press, guys. Question 3. During root canal treatment on 211, sodium hypochlorite was accidentally splashed into the patient's eyes. What is immediate management? You do on tooth number 1, and then sodium hypochlorite went to the patient's eyes. What you do first? A alpha. Very good. B bravo, not Dr. Simra. It's A alpha. Maybe you answered the other question, the previous question. Dr. Leo this time is A alpha, not B bravo. I'm happy for you, Dr. Leo. Dr. Suash, A alpha. Dr. Rana, A alpha. Very good. Dr. Ashwani, A alpha. Fatima. Very good, guys. Easy, easy. I know some of you has chosen E echo, wash with saline. No, guys. We actually wash or irrigate with normal water, with tap water, A alpha. This is initially. While removing the provisional crown, the patient accidentally swallowed a part of it. because rubber dam wasn't used. Oh wow, be careful guys, rubber dam is very important. What is the most appropriate action? By the way, guys, I have posted on our Facebook group about the next sessions and the very important subjects. Very, very, very important subjects. Please let me know which subject we need to discuss and then which day, because I'm going soon or shortly or tomorrow. Say which day is going to be Thursday, Friday, Saturday. Your answer is B Bravo, B Bravo, D Delta, Dr. Jaylan, B Bravo, Dr. Jaylan. Dr. Jaylan is D Delta, B Bravo. Everyone B Bravo. Okay, B Bravo, B Bravo. Okay. While removing the provincial crown, you know what? D Delta perform the maneuver, the Hemel maneuver, not actually recommended that much in Australia. So don't choose it. And by the way, B Bravo was right. Complete the treatment if the patient is stable. As long as the patient doesn't cough, he's fine. If patient start to cough in this case, it means the broken part went into the lung. And if the broken part went to the lung, here really it's an emergency. But if it didn't went to the lung, whereabouts it should be? It should be in his stomach, like his tummy. That's okay. He gonna take it. He gonna take it out. But you can do medical advice after this. Like can take an X-ray to confirm not in the lung. Question 5. Which of the following statement about mouthwash uses accurate? A mouthwash is required. A mouthwash is required as a part of standard oral hygiene routine. Not really. Let me check your answer first. See Charlie? See Charlie? See Charlie? Swallowed, no inhaled. Very good, Dr. Teresa. Yes, it's swallowed, no inhaled. Yes, Dr. Dan, you're right. Which one, Dr. was you? Can that be washed with saline? The eyes, no. I think we like water. Normal water, tap water. Mouthwash can substitute for a proper mechanical cleaning. Mouthwash can substitute. Not really. Fluoride containing mouthwash can be used as definitely. Because sometimes you do vanish at the clinic and then ask the patient to use fluoride containing mouthwash. Mouthwash shouldn't be used in mechanical cleaning. No, it should be. Clorox D mouthwash should be used long. No, that's not right. Not long. Otherwise, it's going to resist staining. So now, guys, we are in to see Charlie. Guys, how was the mock, guys? By the way, the result will be defective because question 6 anyway. I don't think it will be 100%. It will be like 95%. Guys, how was the mock? Would you like me, guys, to do more mock? And the when? Should we use power toothbrush? Who cannot? Who or have difficulty? Yes, yes. You're right, Dr. Ashika, for this. Yes. Guys, how was the mock, guys? Good. Okay, I'm very happy to know this. Yes, of course. Do more mocks. Yes, Doctor, always more mocks. Okay, Dr. Shashank, we can do one more. But we see we have lots of good topics we need to discuss. So we need to discuss these topics too. Okay. The same question was in September exam. I'm happy to hear this. Yeah, definitely because we discuss the same ideas, the same concepts, and the same things, right? More mocks, please. That's okay then. Yes, please. More mocks. Okay, good mock. Okay, I'm very happy. Tomorrow? What tomorrow? Do you want to mock tomorrow? Yes, that's a perfect mock. I'm very happy, Dr. Oski. Yes, Dr. Wazir, you're right. Yes. Was interested. I'm very happy. More mocks. Okay, Dr. D damage. We will do it. Gray mock. I'm very happy, Dr. Lev. Guys, next time, do you want to do it in the same level or harder or easier? Was interesting. I'm very happy to do this, Dr. Sarah. Dr. Bido, in question 2, I know B is right, but could you tell how power toothbrush 1 is wrong? Okay, let me just check it right now for you. Wow, I need to go all the way back. That's not correct. That's gonna be a long way. Okay. Because when I click, it doesn't go there. And it's bad luck for me. Imagine she's choosing question number 2. But anyway, not very bad luck because she may could even have chosen question number 1, the first question. Still, one question away from question number 1. Do you mean question 2 in the same scenario? I cannot remember. Was the same scenario? Or question 2 overall? Seems like the same scenario. Okay. So I went all the way back. That's okay. Go forward again. Forward again. Forward again. Forward again. Forward. 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 Please, guys, as I mentioned, please let me know which topic you want me to discuss next session. It depends on you. As what we did today, okay? Today it was based on voting as well. Now, which terms best reflect the recommendation for effective and safe toothbrush use? Okay. Hard pressure, not good. B, soft pressure, we love it. Why? Because it has gum recession. Okay, that's why we need soft, because it has gum recession, as you see right now. And there is no difference between soft and hard and medium. We found soft is much better even than hard, and it cleans nicely, no problem. Power toothbrush should only be used by those who can operate them without assistance. No, really? Why? This is wrong. The word only made it wrong. Because you know what? There all the people they cannot use the power toothbrush and kids, yes. Even some kids, even I can use them to the power toothbrush. Why not? I can use the power toothbrush for other people because they cannot use it, they cannot operate it. It's fine. Why not? Okay, a patient with stroke, with paralysis. He cannot move his hand. And his young patient, 20-year-old. They cannot operate. Who can operate them without assistance? 1 second, please. Power toothbrushes should only be used by those who can operate them. No, it can be with assistance. A 20-year-old has paralysis. He cannot move his arms. Only he can move his legs. Can I use it for him or not? Definitely, I can help him. I'm his brother, I'm his sister, I'm his assistant, whatever. So I can assist him. Not only these people, it can be used if they can use it by themselves with or without assistance. So the word without assistance not correct. It can be used with or without assistance. Both of them correct. So option D is wrong. Okay. Okay, guys. Thank you very much, you guys. I was very happy, guys, having all of you today. I see, guys, you're getting better by time, and this is actually what we're looking for. If you have done the exam before and you couldn't pass this time, means it just maybe you have already passed three clusters at least or two clusters, so it's only two clusters to work on them, which is means like you actually gonna be very close to pass. And then if this is the first time for you, that's okay, guys. You have 5 months of preparation and see that you got already very good progress, and I'm very happy with this. Dr. Yatri, question four, scenario four, question two, please. What was in this one? Thank you, Dr. Bido. Is there a session tomorrow? No, I think it will be on Friday, Dr. Taslim. It depends on the vote. Let's vote and see, okay? If I have I can leave a post right now with voting for session for tomorrow or after tomorrow, okay? And then see which day actually will be good for you. Thank you very much, Dr. Alifea. Was very good session. Really like your explanation. Thank you, Dr. Alifea, very much. I'm very happy to see you guys. Doctor, from where could we study ethics? We have a subject. It's called ethics and professionalism, and we're going to add one more part in it, which is called responsibility. And then we're gonna share it with you on the right time because now we are in restorative, operative, preventive dentistry. Okay? Yes, Dr. Jilan. Yes. On the right time, we're gonna share it with you as we shared with you restorative this time. Thank you, Dr. Bido. Thank you very much, Dr. Didi Damish. You got 96. You're very good. That's okay, Dr. Didi Damish. I know you will attend all the sessions on the right time then. I know you should have some circumstances. I know you're very smart, Dr. Didi Damish. And I'm sure you're gonna pass. Thank you, Dr. Sarah, very much. Thank you, Dr. Naveen. Thank you, Dr. Kelvenda, Dr. Yatri. Dr. N, thank you very much. Thank you, Dr. Shiva. Dr. Bido, Doctor, just a request. Can we continue the remaining ICDs? Yes. We're gonna continue the remaining ICDs. That's why I put it one of the options of the topics we need to discuss as well. Thank you very much, Dr. Taslim. Yes, I answered this one. I choose B because of this word only, but was confused. Very good. You did the right things. It was B, not D. I don't know, Dr. Yatri, which one, Dr. Bido, scenario 4. Can we discuss this on the Facebook or Telegram? Yes, very good, Dr. Van. Carers use it for people with disability. Yeah, that's explanation why D is wrong. You're totally right. Scenario 5, what's happening, Dr. Ajnit? Me too, me too. Scenario 5, even I selected that's okay, Dr. Ajnit. At least you know it right now. Thank you, Dr. Suresha, very much. Thank you, Dr. Razo. Thank you, Dr. Rana. Thank you, Dr. Ashwini. Thank you, Dr. Dipali. Thank you, Dr. Bido. I got 9 too. Very good, very smart. Thank you, Dr. Vanik. Thank you, Dr. Natali. Thank you, Dr. Asang. Thank you. Thank you, Dr. Sanjita. Thank you, Dr. Gilan. Thank you very much. Thank you, Dr. Daniel, very much, Dr. Daniel. Dr. Nikita. Dr. Bido mocks are like daily dose of vitamins. Need more. You know what? You give me vitamins right now, Dr. Nikita. I feel very happy. You motivated me. You gave me motivation vitamins now, Dr. Nikita. Thank you very much for saying this. I'm very happy to hear this from you. I'm very happy you are happy. Dr. Daniel, thank you, Doctor. It was very fruitful session. Wow, that's a nice word, fruitful session. It's very happy. It's very happy, delicious word, fruitful. I love it. Excited to learn more. I'm very happy to hear this, Doctor. Thank you, Dr. Anam. Thank you, Dr. Fatima, very much. Thank you very much, Dr. Walija. Thank you, Dr. Leo. Dr. Razo, you got 88 in this mock. Hope things goes well this time. Yes, Dr. Razo, I believe so, Chan. Dr. Lev, Dr. Bido, thank you. Also, thank you for all your support and the great questions. No problem at all, Dr. Lev. It's my pleasure. So you're happy, and every one of you guys happy, and you pass the exam then. Yes, yes, Dr. Walid, you're right about the GFR, yes. Source for ICDS, Dr. Jilan, I already give it to you. Did you check that? I already have updated and uploaded everything. I have updated I give cakes, new cakes, totally new for ICDS. I already provide you the links for ICDS. I provided to you even more links for guidelines here in Australia. So please check the plan, please, Dr. Jaylan. Please check the plan. It has everything in it on Google Drive, please. Okay. Thank you very much, guys. See you in the next session. Thank you very much. Dr. Dempo, yes? Dr. Afrin, thank you very much, Dr. Afrin. Thank you very much, Dr. Wazio. Thank you very much, Dr. Fatima. Best sweetener you should advise to the patient for food, stevia. But for dental products, is different. For food, stevia. Dr. Bido, I asked one question, and is in starting about not choosing which one? Dr. Bido, I asked one question. In starting about not choosing my answer at first, which was right, and then select the wrong answer. Please trust yourself, Dr. Dempo. I know how hard it is to confuse yourself, but we say this mostly or always the first intuition is the right answer. Don't change the first intuition at all. The first option, the first intuition you do, please, that's the right one. Please don't change it, please. Okay? No problem. Thank you very much, Mr. Temple. Thank you very much, you guys. I was very happy to have all of you here. I'm running right now to get my dinner. Otherwise, calls will close. Thank you very much, you guys. Have a great night, every one of you. Please, guys, don't forget to comment on the Facebook um, posts because actually they are very important for the next session to decide which session. I need to prepare for it. Thank you very much, you guys. Bye bye. Have a great night.